For some 30 years, I had the pleasure, the honor of delivering a baby most every day of my life. Some 5,000 babies in residency, another 5,000 babies in private practice. Some days I delivered none, some days I delivered one or two or three, but many days I delivered 10, 11, or 12 babies. I delivered babies that could fit in the palm of your hand. I've delivered babies, several babies over 15 pounds. But I'm often asked, what was my favorite part of being an obstetrician? And what I miss the most about obstetric is after delivering a baby, and no matter that I'd done it thousands of times before, when the baby was delivered, waiting for that first cry. You know, sometimes it was seconds and sometimes it was minutes. And I would pray for the baby, waiting for it to cry and doing some things maybe to help it. But my favorite moment was handing that baby to a new mom and dad. It was the most spiritual, the closest I've ever been to God. To see the love, the unconditional love of a mom and a dad, a new mom and a new dad for that baby. So that was my favorite moment. But there's one other moment I want to talk about too, and that was the mom's 15-week visit. 15 weeks. This is a patient that's, maybe she was infertile. Maybe she'd had miscarriages. Maybe everything had been perfect before, but they'd come in 15, 16 weeks, and I get to ask him, are you feeling the baby move yet? And her eyes would light up. Yes, doctor, my baby's moving now. My baby's, it's alive. I can feel it moving in my womb. And I would put my hands on the woman's abdomen and feel the baby. And so many times as I would touch the mom's womb, the baby would push back at me, almost like reaching out, or maybe the baby would kick me. And I'd put the Doppler on the mother's abdomen, and I'd listen to the heartbeat. And I could hear the baby moving. And if there was a sibling in the room, especially a little girl, the little girl would say, Mommy, what's that? What is that? And I could hear the baby's heart rate increase and feel the baby move, responding to that little girl, this baby's big sister, talking. And then when the mom would reply, darling, that's your little brother or sister. And then the baby's heart rate would decrease as it heard its mom's voice for the first time. That was the 15-week visit. And I think that brings us to the Mississippi Dobbs case, which protects life after that same visit. So after 15 weeks, when that baby's responding to mom's voice, its sibling's voice, if the baby feels pain, this Mississippi Dobbs case would protect that baby's life. I recognize personally that life begins at conception. That is my belief. And I understand that not all Americans agree with me on that point, but I believe with all my heart that the supermajority of Americans agree that we should not allow abortions on babies that can feel pain, or that babies that can respond to a big sister's voice or their mom's voice. Ask yourself that question. An unborn baby that feels pain, that knows its mom's voice, should that baby be deprived of life outside the womb? I struggle too, as my colleagues do, knowing that America is a nation, one of 7 nations that allow abortions after 15 weeks. And I point out that most of these other nations are agnostic and totalitarian. I struggle because I know moms and dads who lost babies at 15 weeks, at 18 weeks or 23 weeks. And I recall the mourning, the tears shed at the loss of those babies. And I'm literally torn apart to think about how in my hospital, I was struggling to try to keep that baby in the womb, or maybe resuscitating a baby, an early baby at 22 weeks, while in a nearby town, those same babies, the abortion industry was claiming their lives. I struggle to think that we live in a society that allows this barbaric treatment of the unborn. I've fought my whole life to protect the lives of moms and babies, and I'm here to say I'm going to keep fighting for them. We hope and pray this landmark Supreme Court decision, this case, will result in a decision that reflects the values of most Americans and protect lives after 15 weeks. Thank you.